The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Before I get started, I want to remind you about my course called The Perimenopause Answer. If you are going through the phase of life called perimenopause, or if you're not sure if you're in perimenopause, I would love to have the opportunity to talk to you about the course to see if it is the right fit for you. I really have enjoyed getting to know many of you, and I'm so grateful to you for listening to and sharing the podcast. There is a link on our website, itchyandbitchy.com, and our Facebook page, I&B Podcast, where you can schedule an appointment for a Zoom call with me. I'm afraid I'm going to say it again. This is a Zoom call with me. It is not a webinar. So when you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. Alrighty then. Many of you may never have heard of the MTHFR genetic variant. In my practice, I rarely saw a patient who was aware of this variant. And several years ago, I talked to you about this on the podcast, but I thought it would be a helpful review since most folks still don't know about this gene mutation. Let's start by talking about folate and folic acid. Even among medical professionals, there is confusion about the distinct differences between these two forms of the B9 vitamin. These names are often used interchangeably, which further reinforces the mistaken thinking that they are the same thing. Folate is the water-soluble B vitamin that is found naturally in whole and organic foods. It is recommended that healthy adults get at least 400 micrograms of folate a day to prevent a deficiency. I'll talk later about how to supplement this nutrient if more is needed than what our diet can provide. And foods high in folate include beans, asparagus, eggs, leafy greens, citrus fruits, beets, broccoli, Brussels sprouts, nuts and seeds, beef liver, wheat germ, papaya, bananas, and avocado. Okay, so if folate is the form of B9 that we need and can actually use, what the heck is folic acid? Well, it is the synthetic or man-made B vitamin that is found in dietary supplements and in fortified foods like flour and cereals. What can happen when we take folic acid, a folic acid supplement versus folate? Well, unlike folate, not all of the folic acid you consume is converted into the active form of vitamin B9 in your digestive system. Instead, it has to be converted in your liver or other tissues. So, folic acid is very slowly metabolized in the body into a usable form. Even a low dose of 200 to 400 micrograms is likely not completely metabolized by the time you take your next dose. I'm just going to say that again. A low dose of 200 to 400 micrograms, which is the dosing that's usually in a multivitamin, is likely not completely metabolized by the time you take your next dose. So you might be saying, so what, Karen? It's a B vitamin. How bad can that be if I have extra folic acid in my system? Well, it really is a problem. High levels of unmetabolized folic acid have been associated with several health problems, including increased cancer risk, and it can also mask low B12 levels. If low B12 isn't detected and treated, it can increase the risk of dementia and neurologic problems, especially in the elderly. Here's the deal. Just don't ever take a supplement that contains folic acid. I've been asked about the amounts of folic acid in flour and cereals. Well, if bread or pasta is made from enriched flour, a slice of bread usually contains 37 micrograms, and a half cup of cooked pasta contains 60 micrograms of folic acid. When baking, if you use whole wheat flours, either traditional or white whole wheat. These flours are milled from the bran, germ, and endosperm, so adding vitamins and minerals is not necessary. Although the number of micrograms in fortified food isn't as much as taking a daily supplement of folic acid, you can always use a search engine to search for foods that are not enriched with folic acid. Coming up, I'll be discussing the form of B9 you should be looking for if you take a supplement. We need folate because it plays so many important roles in maintaining a healthy body. Folate helps make neurotransmitters, which are your mood chemicals found in the brain. Remember that most of our antidepressants address levels of neurotransmitters in our brain, and many, many people in the U.S. are on antidepressants. I'm not saying that you should go off your antidepressants and only take folate, but it does make you wonder how much our diet and nutrition deficiencies increase our risk for mood disorders. Healthy levels of brain neurotransmitters are necessary for appropriate stress response, short-term memory, concentration, sleep, appetite control, mood stability, and motivation and desire. Interestingly, I think these are 7 of the top 10 symptom complaints I heard from patients over the years, and I now hear from members in my course. Folate also lowers homocysteine, which is an amino acid that, if elevated in your blood, increases your risk for building plaque in your arteries and developing heart disease. Folate is also intimately involved in making the building blocks of DNA. I'm going to say it again. It makes the building blocks of DNA. Pretty darn important. This nutrient helps remove toxins in the body and is a key ingredient in making proteins. Low levels of folate is associated with increased risk of cancer, increased risk for heart disease and stroke, and increased risks of birth defects. After this quick break, I'll talk about the usable forms of folate and B12 and why some people don't make healthy amounts of the usable form of these B vitamins, so stay tuned. As I said before, don't take a folic acid supplement. The body needs folate. But there is one more piece of the puzzle that you need to know about. Let's talk about the active form of folate, meaning the form that your body can readily use, and it is called 5-methylene tetrahydrofolate, or 5-MTHF, or L-methylfolate. L-methylfolate. So what is the difference between folate and L-methylfolate, you may ask? Well, all of our B vitamins need to go through the methylation cycle, meaning that a methyl group needs to be attached to the B vitamin so it can be used. And a methyl group is made up of 1 carbon atom and 3 hydrogen atoms for you chemists out there. Let me just tell you that the methylation cycle is extremely complicated, but I'm going to try to keep it brief and understandable here. So why is it that some people can't produce appropriate amounts of our usable B vitamins? Well, it's all about a gene mutation. We have a gene called MTHFR, which impacts our body's ability to use folate as it should. Like all genes, we carry 2 copies of the MTHFR gene. On these copies, you can either have 1 or 2 or no mutations. We call these mutations variants. A variant is a part of a gene's DNA that is different or varies from person to person. There are actually 2 different MTHFR variants labeled 677 and 1298, but for the purposes of this episode, I will not be reviewing those 2 variants individually. I will be speaking of MTHFR as a whole. Some people do not carry this variant, and some people carry 1 copy of the variant, and some people carry 2 copies of the variant. About 30 to 40% of the American population may have a mutation of one of the MTHFR genes. It's a big portion of the population. Of those who have 2 mutations of MTHFR, roughly 25% of people are Latino or Latinx, 10 to 15% are of Caucasian descent, and it occurs 2% of the time in African Americans. Gene mutations are inherited, which means you acquire them from your birth parents. At conception, you receive 1 copy of the MTHFR gene from each parent. If both parents have mutations, your risk of having a homozygous mutation, which is 2 copies of the mutation, is higher. If you have been tested and know that you carry 2 copies of the MTHFR variant, you will definitely pass on 1 copy to your biological child. I'm going to walk you through something called the methylation cycle. Again, it's a complicated cycle, so I will try not to get too deep in the weeds on this. During the methylation cycle, a methyl arm is attached to our B vitamins so they can be used by the body. Let's start with an example of someone who has no MTHFR genetic mutation, meaning that the MTHFR gene is what we would say is normal. When someone does not have a mutation in MTHFR, a methyl arm can be attached to the B vitamins, so we are able to make the folate form called L-methylfolate. And when methylation is normal, we are able to produce methyl B12. These are the usable forms of folate and B12, L-methylfolate and methyl B12. Also, when MTHFR is normal, meaning no variant is present, the conversion process toward glutathione doesn't get stuck at homocysteine. It continues to convert to glutathione, which is our master antioxidant. So we don't want homocysteine, we want glutathione. Glutathione is our powerful antioxidant. And I'll talk about homocysteine a little bit later, but that's something we don't want. We want glutathione. Now, when someone has an MTHFR mutation, these cycles do not function right, and we don't make our B vitamins usable by adding a methyl arm to folate and B12. When you carry an MTHFR genetic mutation, there is a glitch in the process, and this glitch in the works disrupts our ability to convert folate to L-methylfolate and B12 to methyl B12. Both are very important for our healthy neurologic function in our body. Also, during the latter part of the methylation cycle, we make something called SAMe, which many of you have heard of. You've probably seen a supplement called SAMe that can be purchased over the counter to help with depression and anxiety. If you are not making SAMe, people can have depression, anxiety, increased osteoarthritis symptoms, fibromyalgia, and cognitive decline. We're back to that brain fog, which I talk about all the time. Also, when the process gets stuck at the homocysteine level, homocysteine levels become elevated because it does not convert to glutathione, which is the one we want. And high homocysteine levels increase the risk for forming clots in our blood and making plaque. And we don't make healthy levels of glutathione, which, as I mentioned, is a powerful antioxidant and is a key piece in kidney health. Again, when someone has an MTHFR mutation, the latter part of the methylation cycle also does not function right, and as a result, we don't make healthy levels of SAMe and glutathione. In addition to all I've shared with you thus far, when folate isn't appropriately used because of the presence of the MTHFR mutation, we also don't produce healthy levels of serotonin, dopamine, tryptophan, and tyrosine, which are key neurotransmitters and amino acids needed for stable moods. When someone has 2 copies of the genetic mutation, they have increased risk for decreased enzyme activity levels. Enzymes are super important in our whole body for a lot of different reasons. We also have elevated homocysteine levels, as I said, especially with concurrent deficiencies of B12, B6, and folate. We have a 3-fold increased risk for premature cardiovascular disease. We have an increased risk for blood clots. And in pregnancy, if either the mother or the unborn baby carry 2 copies of the 677 mutation, which I mentioned earlier, it has been associated with a 2-fold increased risk for neural tube defects such as spina bifida or anencephaly in some, but not all populations. We also can have obstetrics complications such as severe preeclampsia, placental abruption, severe fetal growth problems, and fetal demise. They're all associated with 2 copies of MTHFR variant. When someone has 2 mutated copies of the MTHFR genes, it confers higher risk of health complications compared to someone with 1 or no mutations. However, even 1 mutation, which occurs in up to 50% of the population, makes it more likely that you will have migraine headaches or other low serotonin medical problems like depression, anxiety, irritable bowel, or fibromyalgia. Impaired methylation due to the presence of the MTHFR mutation can result in decreased dopamine production, which can lead to ADD or ADHD. People with low levels of dopamine lack focus, concentration, short-term memory, organization, emotional stability, good sleep hygiene, and hormone regulation. Yeah, I said it. Hormone regulation. So how do you find out if you have a mutation of the MTHFR gene? Well, you can ask your PCP to do a blood test for you. Sometimes they will agree to this and sometimes not, depending on your provider's comfort level with doing genetic testing. You can now get this testing using direct-to-consumer testing, meaning you can order the test yourself. It is usually completed through a cheek swab test that you collect at home. Companies that offer this testing include Empower DX, Applied Ingenuity Diagnostics, and RX Home Test. At the time of the airing of this episode, the pricing for this test in those 3 companies ranges from $89 to $109. So what do you do if you have an MTHFR gene mutation? You replace the L-methylfolate and methyl B12 that your body isn't making for you. Glutathione and SAMe may also need to be supplemented. For depression and anxiety, we use 7.5 milligrams to 15 milligram dosing of L-methylfolate once daily. For peripheral neuropathy and mild cognitive impairment, we use 5 milligrams to 10 milligrams of L-methylfolate once daily. These are much higher doses than the L-methylfolate supplement you can find in most over-the-counter supplements, which usually contain up to only 1 milligram or the equivalent of 1,000 micrograms. There are high doses of L-methylfolate available over-the-counter at websites like methylpro.com. There is a prescription form of L-methylfolate called Deplin that is a once daily dosed med that is indicated for major depressive disorder. It is available in 7.5 milligrams and 15 milligram doses. Another prescription called Serafulin NAC contains a lower dose of L-methylfolate than the Deplin and contains NAC, which is N-acetylcysteine, a wonderful brain amino acid. This prescription is indicated for mild cognitive impairment. That's the Serafulin NAC, indicated for mild cognitive impairment. These 2 prescriptions are considered medical food, and unfortunately, the majority of insurance companies do not cover this category of prescriptions. And the company that makes these 2 prescription supplements, Deplin and Serafulin NAC, now have an option to have a telehealth visit with a physician to get the prescription of Deplin or Serafulin NAC. You can find the link for that information on the official website, Deplin.com. So that's D as in dog, E, P as in Peter, L-I-N as in Nancy, Deplin.com. These meds also come in a generic version, which your own provider would have to prescribe for you. When I was practicing medicine, I often found that my patients received significant benefit in the neurologic symptoms they were having when L-methylfolate and methyl B12 were replaced. The beauty of this treatment is that we can see resolution or improvement in these symptoms with just the addition of specific B vitamin supplementation. Thank you for listening to and for sharing the podcast with others. If you listen using the Apple Podcast app, please leave a review and rate the podcast. Your reviews and ratings matter. I encourage you to visit our Facebook page, IMB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me, not a webinar, so we can chat about how my perimenopause course can help you if you are going through this phase in life. As always, thanks to Forrest Winsel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thanks, Forrest. Check out his album called An Awful Lot. Go to wherever you stream your favorite music to listen. If you don't know where to stream music, you can find the album on Apple Music or Spotify. Remember, your health is in your hands.